Welcome, everybody, to another episode of Big Data, Big Issues. I'm your host, Sheldon Kreger, and today we'll be discussing the coronavirus and the rise of surveillance in China and the way that this has impacted our interpretation of when it's appropriate to use surveillance versus when it's inappropriate to use surveillance. Recently, the media in the United States has been doing some reporting on the situation in China. And it's been really interesting to see the response showing both the pros and cons of using surveillance in a crisis like this. To give some context about the current situation at this point in history, today is March 15th, 2020, and we're really starting to see the coronavirus spread across the United States with several, I think close to 3,000 cases reported as of yesterday. Starting to see around 100 fatalities, maybe more than that now. In China, they've been dealing with this since November, and they've started to get the new cases per day number down in recent history, which has been very good news for them. And we will be discussing that in a little bit more detail. What they did in China is they were able to use surveillance and big data technology to perform real-time analysis and contain the virus in a more thorough manner. This includes monitoring the population through drones and giving individual instructions to individual citizens to quarantine or to go back indoors, that kind of thing. They also used facial and body recognition software alongside camera systems to record temperature of individuals. For example, giving cameras to police officers to use to identify people who were running a fever and force them to quarantine. They also used tracking in the public transit system using national ID numbers to start to track people's movements and to block people from moving within their cities if they were believed to be infected. And finally, they partnered with a large corporation, Alibaba, using their Alipay health code application, which was something that was developed in response to the crisis. And what this does is Alipay is a payment system similar to Apple Pay or Google Pay in China. And a lot of people use this application already. They added some kind of sister app. I don't know exactly how, if it's inside of the Alipay app or if it's a separate thing. But citizens were required to install this, and it would run through their personal data and their geolocation history, and it would assign them a color code depending on their risk of their infection level. And how that works is, as of February 24th, there was actually an official briefing on this. It's largely secretive, but there was an official briefing stating that in Zhejiang, apologies if I pronounce that incorrectly, a province in China, which is basically like a state in the United States, 90% of the population had installed this app, which is about 50 million people, and had registered using the application. And about 98.2% of those people had green codes. But that's good news, but it also left them at about 1 million people with red or yellow codes. If you have a yellow or red code, there were restrictions placed upon you, including being stopped at travel checkpoints, and other, perhaps being visited by authorities, being forced into quarantine centers, that kind of thing. The rules are pretty secretive, and citizens were largely confused about what to expect if they were assigned a yellow or a red code, what the consequences of that were. People also didn't really understand what was causing them to have yellow and red codes. For example, was it because someone in their family was sick? Was it because they had been on a bus or a train where people were known to have been sick over the last couple of days? There was no transparency about how this worked, but it was widely reported through a investigation by Time Magazine United States, I believe, that there was definitely reporting to the police directly from the application, and this was all tied in directly with China's national surveillance system. Actually, it was a New York Times article. I apologize. This is from March 1st, and this is a quote from the article. The Times analysis found that as soon as a user grants the software access to personal data, a piece of the program labeled report info and location to police sends the person's location, city name, and an identifying code number to a server. The software does not make clear to its users its connection to the police. But according to China's state-run Xinhua news agency and an official social police media account, law enforcement authorities were a crucial partner in the system's development. While Chinese internet companies often share data with the government, the process is rarely so direct. In the United States, it would be akin to the Center for Disease Control and Prevention using apps from Amazon and Facebook to track the coronavirus, then quietly sharing user information with the local sheriff's office. And this was a tool that was used to help lock things down, and to also to perform research. There was another news article that I found from the New York Post on March 9th called Coronavirus Can Travel Much Farther Than Previously Thought, Study Finds. And it was citing a article that had been published that day or the day before from a Chinese journal of medicine. I don't remember the name of it, but I did take a look at the article briefly. And it was reporting the findings of some epidemiologists and a group of experts on the disease, where they were able to figure out that the coronavirus is actually airborne and not just transmitted through surface contact or through person-to-person contact, which up to that point in time had been a point of debate. And what they did is they used surveillance data to reveal that the coronavirus was traveling through the air by looking at historical geolocation data for a group of people who had been targeted to be known for being infected. So basically, these people ended up in a quarantine center or a hospital and had been known to be infected. They looked at their geolocation data, and they were able to identify all one place where they had all been at the same time, which is where they had contracted the virus. And it was on a public bus, or maybe it was a private bus. It was on a bus, and there was, so they looked at everybody on that bus, and they were able to find one person on that bus who was actually known to be infected before that bus ride. So one person came onto the bus infected. Everybody else was known to be uninfected based on the geolocation data and other data that they had collected and put together. And so they started asking, like, what happened on this bus? How did it transfer from this one person to everybody else on the bus? And due to the vast nature of China's surveillance system, they were able to dig up the video surveillance footage from that bus and review it manually. So they were able to sit back and watch it and see that there had been no physical contact between the person who was infected before the bus ride and the people who were infected after the bus ride. And so that was like a clear indication that the virus was actually spreading through the air and not through like handshaking or high fives or hugs or something else that was not going on the bus that day. It's worth noting that there were several other dramatic measures being taken in China and continue to be taken in China to help get the situation under control. For example, on January 23rd, they cut transportation in and out of the epicenter city, which was Wuhan. So people couldn't travel in and out. I don't know the details in regard to how they got supplies, food, that kind of stuff, basic necessities in and out of the city. There must have been some transportation in and out that was highly regulated. I don't know the details of that, but they did cut general transportation. They also rapidly expanded that program to other cities, totaling forbidden travel on about 60 million people in China, based on the best numbers I could find. And there were also varying restrictions within these cities, within the city limits. So not just between the cities, but inside of the cities. They had checkpoints, apartment complexes that had been fully locked down with officers standing guard, making sure that people weren't coming out. So if you had installed this Alipay application, which pretty much everybody did in some of these cities, and then they found out that a bunch of people in your apartment complex were all infected, they would just lock down the apartment complex completely until the 14 days or whatever had gone by. And that had pretty widespread ramifications for a lot of people, obviously. They also performed door-to-door inspections. They looked at infected people specifically and forcibly quarantined them, so dragged them off to quarantine centers and hospitals. And if you had, like I said, if you had a red code on this Alipay app, they would stop you at travel checkpoints and take you into quarantine, that kind of thing. And so it was a pretty dramatic situation over there. I also found a New York Times article from March 1st detailing this color coding in a little bit more level of granularity. And here's a quote from that article. With fear of the virus still acute, many in China take comfort in high-tech precautions, even if they're at times impractical and dysfunctional. Du Wang, 26, said her code was red for a day before it inexplicably changed to green. Calling a support hotline yielded no answers. Yet she still approves of the system. If we had been using it indefinitely, that would be crazy. Just way too big a pain, Miss Wang said. But for the epidemic, it makes sense. She shrugged off the privacy concerns. Alipay already has all our data. So what are we afraid of? Seriously. And I think that this quote really encapsulates a worldview where surveillance has become the norm, and not just government surveillance, but corporate surveillance, and the normativity that we've seen unfold between governments working together with private corporations to collect personal data and having the right and authority to leverage this information in an urgent situation. So we have to, what I want to do now is step back and ask, was this effective? And it's very difficult to say because this situation, first of all, because I don't have the expertise as an epidemiologist to even say whether this is under control in China or not. Second of all, it's hard to understand because this situation is so unprecedented in terms of the way the contagiousness of the virus compounded with the lethality, and also the incubation period, which makes it very easy to transmit, because a person can carry the virus for 1 to 7 days before showing any symptoms, and in that period of time they're contagious. And in fact, people may never actually even show symptoms and have had gone through that phase of being contagious, so they can recover completely, spread it to somebody else, never even knowing that they had it in the first place. And so there's a lot of complication when we discuss the effectiveness of this application. And we also have to take into account the other radical measures that they took, in particular, locking down these entire cities, blocking freeway exits, on-ramps, that kind of thing, closing down the train stations. This is all of these things worked in synchronicity to alleviate the situation. And if you view the YouTube video, what I have pulled up on the slideshow right now is a chart starting on January 22nd, 2020 and ending on March 14th. It's a graph of daily cases that I found online. So this is new cases reported by day, the number of new cases, and it peaks at around 5,000 new cases per day on February 5th. So within that 10-day period between January 22nd, there were no cases. By the 23rd, new cases trickling in. And then by February 5th, it had kind of peaked close to 5K. And then it slowly tapers off And honestly, by about February 21st, the number of new cases is below 1,000, I would say, looking at this rough graph. And what that indicates to me is that the lockdown that they had implemented, compounded with the application and all these other measures that they took, were actually pretty effective in containing the spread of the virus. But I can't say that with any sort of credibility. This is just my personal intuition. The other thing to look at in this context is the situation in Italy currently, because we can see how they've had a lockdown without using some kind of application like this. But the problem looking at the data in Italy right now is they haven't been dealing with the problem for as long as China has. And so they haven't started to see the taper off in new reported cases per day. And they're above 3,000 new cases per day at the moment, with that beginning in February 22nd. So that's about a 3-week period between February 21st and March 14th, where there's just been this growth of new cases from 0 to about 3,000 to 4,000 per day. And they've implemented a voluntary lockdown situation where people are asked to stay at home unless they need to go out and get supplies or if they need to take care of sick relatives. And so hopefully this will help resolve the situation there. But it's very, like I said, it's very difficult to understand the impact of this application in isolation. And so as practitioners, when we think about the ethics of using something like this, as much as I would like this case study to have like a clear yes or no answer, it just really doesn't. This is just one measure that can be used in conjunction with other things that may have some benefit. And then we have to sit back from an ethical perspective and weigh the pros and cons of using something like this. So to get to the direct question, which is, should we implement a similar system in the United States? The answer to that is it's very difficult to, like I said, to weigh the impact of just that kind of application level surveillance, and whether that would be effective in the United States as it was in China. What I can say is that lockdowns are pretty bad for a number of reasons. First of all, because of the economic damage that they cause, asking people to stay at home or forcing people to avoid traveling between cities. It really is bad for commerce. People end up missing work. People end up missing paychecks, and people end up missing mortgage payments. Kids can't go to school. All these kinds of things is just very damaging overall. And this is something that we want to avoid pretty much at all costs in the United States, although we're starting to do this already. Personally, I live in the Seattle area, and we have more or less a voluntary lockdown situation here at the moment. The governor's banned meetings with more than 250 people. They've asked everybody to stay home if possible. And people who do have to go to work are asked to hold meetings with distance between individuals, try not to have more than a few people in one room at a given point in time. A lot of defensive measures have been promoted here in Seattle, and this is kind of the trend throughout the country right now. The seriousness of a lockdown is kind of what we have to weigh when we ask the question, should we use surveillance to respond to an epidemic like this? And the question really is, can we avoid a full lockdown, or can we minimize the time that we're in one of these full lockdowns by using surveillance data and big data technologies to respond to the crisis instead? So if we have more detailed information about who is infected and who is not infected, can we leverage that? And first of all, can we get that data with surveillance? That's the first question. And the second question is, can we then use that to implement a quarantine in an effective manner? And is that going to be enough to prevent a widespread lockdown situation? And I don't have the answers to those questions, but I think as practitioners moving forward, those are the kinds of questions we need to be asking ourselves in the context of the ethics of this kind of technology. I have one more quote from a Time magazine article on March 13th titled "China's Draconian Lockdown is Getting Credit for Slowing Coronavirus. Would it work anywhere else?" Others say that even if the lockdown measures aren't implemented, Others say that even if lockdown measures are implemented, that alone isn't enough to stop the spread of the virus. Cao Ling of the University of Hong Kong tells Time that China's lockdown wouldn't have worked if officials had not also paired it with rigorous containment measures. Widespread testing to find as many cases as possible, then isolating those infected, and quarantining any contacts who might be infected to stop the chains of transmission. In Wuhan alone, more than 1,800 teams of epidemiologists, with a minimum of 5 people per team, traced tens of thousands of contacts a day, according to the World Health Organization mission report. And so what this scientist from China is saying in this quote is that use of surveillance technologies alone would not have been enough to contain the spread. And I think that's a pretty important thing to consider. The final consideration that I want to mention is that these technologies, once they're implemented, once they're out in the wild, they tend to become used more and more broadly. And this is the concern for facial recognition technologies and the ethics of those being debated today, is that if we deploy them to help law enforcement, for example, catching burglars and tracking down people who've been kidnapped, that kind of thing, is it a slippery slope to more draconian techniques and predictive policing and that kind of thing? And that's one of the real dangers that we have to weigh as practitioners. There's a Italian philosopher named Giorgio Agamben, who writes extensively about the nature of sovereignty and the origins of power and the way that power functions in today's world. He has a book from 2005 called The State of Exception, where he really expands upon the work of some previous authors about the way that the government exerts its authority, not only through the practice of the laws that are on the books and by enforcing those laws, but also by suspending the law. And for somebody like Agamben, this suspension of the law, or the state of exception, is really the locus of sovereignty. And this is the ultimate form of power. Having the ability to say that the law no longer applies it gives a pathway for the most gross human rights abuses in history. And in fact, he has a book on the topic looking at Hitler's Third Reich as a 12-year-long state of exception, which is a very disturbing thought. And in his book, The State of Exception, he investigates the increase of power by governments in which they employ this technique in supposed times of crisis. Within a state of emergency, Agamben refers to the states of exception where constitutional rights are diminished, superseded, and rejected in the process of claiming this extension of power by the government by using some kind of crisis to justify the suspension of the law. And we've seen this in the United States in the post 9/11 era, used to justify torture, for example, and to expand surveillance, of course. And in China, this is exactly what is going on. That being said, in China, they also have a situation where they were already doing a lot of this. If I can find my slide, apologies 1 second here. Looks like I lost the slide. But what's been going on in China for a number of years now is they've been using surveillance systems in the northwest region of China, where there's an ethnic group of Muslims in China, and the Chinese government believes that Muslims are a threat to national security. And so they've used big data technology in a very broad manner to identify people who they believe to be Muslim and round them up and put them into re-education camps. And they've done this to over 1 million people now. The data is very secretive and hard to pin down on this. Tracking the exact numbers, obviously, this is very confidential for them. So it's difficult to understand the full impact. But based on the reporting I've seen, they have these re-education camps that are operated like prisons, where they take people they've identified by their web browsing history, by facial recognition techniques, by their hairstyles, by the clothing they wear, by the other people that they affiliate with, by family members, their friends, and so on. And they have been trying to basically exterminate the religion from China using this technique. And so this is definitely a very real danger for a slippery slope if we were to implement this kind of system in response to an epidemic in the United States. And that's sort of the final consideration that I want to end on today. The best way to support this podcast is to like and leave comments, as well as share the episode with your friends and colleagues. You can find detailed notes, reading suggestions, and a complete episode list at bigdatabigissues.com.